So welcome again, folks, to our Friday Healthy Conversations. We're doing this every Friday at noon from now until World Diabetes Day. This is our, I think, third week. And this week we are happy to be joined by Michael C., a clinical exercise specialist with the Joslin Diabetes Center and Southcoast Health. And he has a presentation for us today, Exercise, the most underutilized treatment for diabetes. Before we get started, I want to remind you that you can chime in with your questions anytime. You can type them into the chat. You can click the Q&A button on the bottom of your screen here on Zoom and type in your questions, and Michael will do his best to answer them. We are recording this session, and it will also be streamed live to YouTube, so folks will be able to watch it at their convenience. With that, I am going to turn it over to our presenter, Michael. Thank you.
Mark, thank you so much. I want to thank Daniel for the opportunity to be with you today. And Mark, you've done a great job. I'm so grateful. Today's topic is exercise, the most underutilized treatment for diabetes. And I would say that it's the most underutilized or movement in general for many chronic diseases or conditions, or for people desiring to live a full, healthy life. So as Mark had mentioned, I've worked for 15 years or more in the diabetes field at Joslin Diabetes Center and Southcoast Health and so forth. So I'm excited to be here. And Mark is going to advance the slides for me, since I have a slow computer. So today we're just going to talk about the joy of movement. And I may be preaching to the choir here, but I contend that now more than ever, for very different reasons that I'll talk to you about, that, movement is so important. And I spend a lot of my day talking to people virtually that are, locked in their house in the residence for whatever reason. And, that environment isn't conducive to good mental and physical health. So we'll talk about why joy, movement is more important now than ever. Actually, physical activity is probably the most underutilized treatment for intervention for diabetes. Often, though, we'll hear a commercial or a healthcare provider may say, remember, diet and exercise, and then, go forward and write a prescription for a medication for you. So at the foundation, and I'm sure it's a topic that has been covered or will be covered, about, what foods we put into our body and how they impact our health and our prevention or management of diabetes. And we'll just talk about the benefits of being physically active and fit, and we'll distinguish between those two, and the role it plays in preventing or the treatment of diabetes. Some people, for various reasons, by no action of themselves, will have diabetes, and we'll talk about the role that being active plays in that, managing it. And there's a right program for everybody. I was on a call just this morning, and a woman said she would try something. I said, if it doesn't work for you, let's try something else. But there are some strategies that we can try out to stay with a program. And with diabetes, more than many other conditions, there are challenges, and how do we overcome those? And we'll just talk about some special considerations. So we have a lot to cover. So next slide. But before we do that, I'm going to invite you just to stand up. You can just advance one more time. Because, there we go. Because one universal language, we often say music is the universal language, but also is activity or movement. So whether somebody has a disability or whether somebody, I've been to the Middle East numerous times, and although we have cultural differences and there is a universal language of movement, and you notice that joy is on everybody's face there. So I'm going to invite you to stand up with me. So just kind of move it. If you're seated, just move the chair a little bit. And although I can't see myself here, I'm assuming that you can see me. So I want you to just stand up nice and tall. And I want you to take your hands and just rub them together. So create some warmth in the palms of your hands. And then I want you to imagine that you have water on your hands. So just flick your fingers all over. Just flick them like you're trying to get that water off your fingers. And just do it all over. There's no right or wrong way to do this activity. So just flick. Good. I want you to add some movement to your shoulders now. Just roll your shoulders, whichever feels good to you. Forward, backwards, just roll them. Any tension or tightness in your shoulders, just kind of invite it to dissipate. Now I just invite you just to kind of move your arms overhead, just alternating. Be as gentle or as aggressive with this activity as you choose to. And now just move your arms side to side. Just let the weight of your hands and your arms just kind of take your arms as you, I call this a Zen swing. Just go side to side, nice rhythmic movement. And just take a moment and just to think of how your body, and move whatever you can do. If you need to do these in a chair, that's fine. And just come to rest and just take a moment just to survey your body. What that 60 seconds or 90 seconds, how that felt. You may notice that anything that was troubling you or your mind was focused on may have just kind of went away. You may notice a smile come to your face. You may have felt a connection between other people that, you were doing the activity together, whether you were, miles away. It kind of brought us together. And usually being active brings hope. Brings positivity. It helps clear our mind. So I hope you enjoyed that. And just 3 minutes of that throughout the day can really, bring so many benefits. So we'll take the next slide. Why now more than ever is this important? Well, this is a slide, a study that was just published earlier this year, and it looked at different cities in the United States, and people wore, activity monitors. And you can see that, in March of this year, there was a precipitous drop in the amount of physical activity. People were isolated, locked inside. And then you could see that for many months, that pattern. And just think about what that does to people where they're isolated, they're not able to get out. And so one of the best therapies or best treatments now to combat many of these feelings of isolation or sadness or depression or whatever it may be is really just to move. So I invite you, if those feelings speak to you, as well as for individuals with diabetes, that inactivity can lead to many habits around food, around, and really adversely affect blood pressure, blood sugar, in so many ways that we'll talk about. So hopefully that, if this was you, as it was for many people, we're starting to get back to some normalcy and really taking this opportunity, particularly during this fall season, to get fresh air and activity. So next slide, please. And, what I'm saying isn't something that I'm making up. Countless studies have shown that, people that are more active, whether whatever culture they are from, whatever disability they maybe have, that more activity brings greater satisfaction with life, more positive interaction, socialization with family and friends. And stressful events just take less of a toll and well-being. I don't know if that resonates with you, that these last 6 months have been very stressful, and that people that have regular exercise are more resilient. So next slide, please. So I invite you, if these ideas, these thoughts speak to you, Kelly McGonigal is an amazing speaker and writer. And in her book, The Joy of Movement, she conveys many of these thoughts. She's a psychologist, and she studied the effect of movement on the brain and behaviors. So here's a wonderful resource, and Google her if you would, and she has one of the most well-attended YouTube videos. So next slide, please. So before we advance, I want you to take a pause and think. I want you to think about, when you think of diabetes, what comes to mind to you. Just kind of close your eyes, and this is where it would be so wonderful if we were here in person together. You know, what comes to mind to you? You know, terms like, you know, medication, you know, insulin and pills and doctor's visits and tests, and pancreas, you know, and you may be affected by diabetes-related complications, the burden of having diabetes, or for some people, having diabetes, you know, has really helped them step up and improve themselves, you know, overcome overcome obstacles and barriers. You know, I'm not sure what speaks to you. It's probably a combination of those. You become more resilient. And so these are some terms that kind of come to mind if you're in the diabetes diet: sugar, of course, insulin, hormones, you know, pancreas. So let's be honest, let's be open. Managing diabetes is difficult. There are few conditions that require 24/7 care, whether it's self-monitoring and medications and the constant, you need to lose weight, keeping logs, you need to exercise, you need to take care of your heart, eye exams, blood pressure, cholesterol, you know, and I hear it, you know, I hear it in my patients that it's challenging. And so, you know, we need to be kind to ourselves. We need to understand that we need to not try to be perfect. You know, we're human, and we need to celebrate our successes on our journey as we try to prevent or manage diabetes. So you may not know Sir William Osler, but you do know of an institution that he founded, and that's Johns Hopkins. And you know, he was born in the 1800s and lived into the early 1900s. And one thing he says really resonates with me is that, and I hear this week, I've had a number of clients or patients that, you know, what they've done isn't just good enough. But he says to live a long, healthy life, develop a chronic disease and take care of it. And we know one component of taking care of diabetes or any condition is being physically active. And he says one other thing that resonates equally as well. And this says physician, but I would say any healthcare, you know, provider. I would say any friend, you know, a good friend or physician or nurse or diabetes educator, as I am, you know, treats the disease. But the great physician or diabetes educator or dietitian treats the person who has the disease. So really to understand, and this is where we should be in healthcare, is that, you know, we need to understand the person more importantly than we need to understand the disease. I would contend that before somebody wants to know how much you know, they want to know how much you care. And knowing how much you care is to understand you and your relationship with, in this case, diabetes. Next slide, please. We're probably all familiar with the different types of diabetes. I spent, working at, a diabetes center of excellence. I actually spend as much time with people with type 1 diabetes. That really only represents about 5% of people with diabetes. And then, of course, the more common type 2 diabetes, and often gestational diabetes. I will say there are other types of diabetes. There's people that type 1.5, that people are diagnosed with what type 2 diabetes later in life, but really what it is a slow onset type 1. So what characterizes this? Usually most people think that type 1 is diagnosed earlier in life. Usually the mean age is about 15, but as I said, an individual can be diagnosed or misdiagnosed with type 2, but often have type 1 much later in life. The onset can be often quick with thirst and weight loss and frequent urination, and could result in a hospitalization. Generally not overweight, but can be overweight, just because 2/3 of our society tends to be overweight. So a young child, a teenager, could be overweight and experience type 1 diabetes. And it's an autoimmune condition where the body doesn't produce insulin. And so the only treatment for it is insulin. So in 1921, fortunately, Banting and Best discovered insulin, and it has constantly evolved for the last 100 years. The more common, type 2, we generally say usually older, but we do have adolescents that will be diagnosed with type 2 diabetes. It's a slow process. Usually people can have it, usually it's not diagnosed for probably 5 to 7 years after somebody's actually had diabetes, although, healthcare is becoming more, proactive and having the necessary tests. It often is associated in many instances with weight, and with weight comes a condition called insulin resistance. And, if addressed early, can be treated with, lifestyle modification, but in some instances, often, medications, either oral or injectables, and perhaps insulin are required. And there's a connection between, family history, ethnicity. And last one is gestational onsets with pregnancy, usually identified through routine testing, oral glucose tolerance test that's standard during a woman's pregnancy period. And best to try to manage it with, lifestyle modification. Some instances, oral medications or insulin may be required. So those are kind of the 3, types of diabetes. So if I was to tell you I had a medication that could really in many cases prevent or reverse many conditions like hypertension, high cholesterol, high blood sugar, excess weight, feeling of fatigue or weakness that comes in with aging, or bone fractures or falls, or cancer, certain types of cancer. If I were to tell you I had a medication that has been found to be effective in those conditions throughout the lifespan, that can provide joy and satisfaction, would you take it? Well, I hope you would say yes. And that medication is really just moving our body, physical activity. Or, the difference with exercise would be purposeful physical activity. or planned exercise. So that's what we're going to talk about the remainder of this presentation. So this is just a picture of all the issues that come into play with managing diabetes around nutrition, blood sugar, medications, in the case insulin, in the case of type 1. So next slide, please. Well, why is being regular physical activity? And the difference is, we can get up. We just did some physical activity prior to the start of this program. I wouldn't call that necessarily exercise. If you wanted to call it, that'd be great. But if you just got up and moved around, you may just saying, I'm just starting to move, or I went for a brief walk, or, I'm taking an exercise class at 5 o'clock today, or I'm going to the gym. That would be more exercise. So, exercise is planned, physical activity, perhaps more structured. Why is it so effective in managing diabetes in particular? Well, really improves our sensitivity or response to insulin, to whether it's the insulin our body produces or the insulin we have to take. So there are a number of physiological responses that make us more sensitive to insulin. And as you know, we need insulin. Insulin is produced by our pancreas, and it helps bring glucose into the muscle, liver, and fat. But exercise or movement uniquely can bring glucose into the muscle in the absence of insulin. So it just makes it work more effective. It lowers blood sugar. Perhaps that's an experiment you've done. You've checked your blood sugar before and after a bout of activity. And you can see the favorable effects depending upon a number of variables, but probably the most important factor in terms of some of the risks associated with diabetes, whether it's kidneys or cardiac, heart, is our blood pressure. It favorably impacts our blood pressure acutely. And then if we do exercise regularly, it'll positively affect our blood pressure. Our cholesterol or our lipids helps with weight management, although certainly what we put into our body has an important impact on that. And it reduces the risk of developing many of the diabetes-related complications, first and foremost, cardiovascular disease, and we'll see that now. So next slide. So this is just, you'll see a graph here is, what is research found to be the impact of physical activity and exercise in the case of type 1 diabetes. Certainly it favorably impacts, and we know more about physical activity in type 2 diabetes, but over the years we've learned a lot about the impact. We've studied the impact of exercise and physical activity on type 1. We can increase fitness level, and fitness level is like a vital sign. You think of your heart rate, your blood pressure, your blood sugar. Well, your fitness level is a vital sign. Lowers your insulin requirements, favorably impacts lipids. Certainly your blood vessels and diabetes, many of the complications are what we call micro or macrovascular diseases of the eyes, the heart, the vasculature. It favorably impacts our blood vessels. People that are more active, that have a history of type 1 diabetes, live a longer life. Decreases insulin resistance, decreases cardiovascular disease, and probably most importantly, improves well-being. There are uncertain, yet to be studied, particularly in the type 1 population. Does it affect our beta cell function? How does it impact? There are so many factors that go into glycemic control that there's only modest impact on A1C, but you could see acute changes in blood sugar. Next slide. There's certainly in type 2 diabetes much more well studied and to a greater extent, similar benefits around cardiovascular disease, blood pressure, cholesterol, insulin sensitivity, decreasing medication or insulin requirements, increased fitness. So next slide. Oh, sorry about these slides. So I don't make this up. This is just a slide from the Aerobics Center longitudinal study in Dallas, Texas. And this research over the last 20 some odd years has really provided some great insights. What they've done is they administer stress tests. So sometimes we can look at people's physical activity patterns by having them fill out a questionnaire or attaching a pedometer to see how active. In this particular test study, they administer a stress test. So where these people between the ages over 6,000 of them got on a treadmill and walked, and how well did they do it? You know, how long could they exercise on the treadmill? And they followed these people for a mean 17 years for the diagnosis of diabetes. And lo and behold, of these 6,200 women in this case, that were the 143 that were diagnosed with diabetes, lo and behold, they tended to be lower, they tend to be less fit, they tend to be heavier, had many of these risk factors for diabetes, high blood pressure, family history, and high cholesterol. So what they found out that if you had better cardiovascular fitness, that cardiovascular fitness and body mass index were independently related to risk. So the higher your fitness level, you can see on this graph here, all the way to the right, they had the least incidence or rate per 10,000 woman years of coming down with diabetes. The least fit, they had the greatest likelihood. So here's an instance. Now, some people are fit because they had good genetics, but generally because of their activity patterns and habits. So next slide. This is another study, the Nurses' Health Study, that looked at physical activity and risk of cardiovascular events. So these are women, 5,100 women that had type 2 diabetes, and they were followed for 14 years. And the age adjusted, you don't have to really appreciate relative risk, but the risk of cardiovascular disease and stroke decreased with an increase in moderate or vigorous physical activity. So in this case, they administered a questionnaire, and they found that, you know, walking, just simple walking, not necessarily going to the gym or anything like that, was associated with a decreased risk of cardiovascular disease, and that the faster you walked was independently associated with a decreased risk. So the amount you walked and the faster you walk had favorable benefits. And just last one, if I haven't proved my case, you know, this study looked at 3,700 people with type 2 diabetes again. And, you know, I often talk to people that are very active and really lead healthy lifestyles, and they have diabetes, you know, and that's the reality. And going back to Dr. Osler, remember, have a chronic disease, manage it, and live a healthy life. But they follow these people for almost 19 years, and hypertension, elevated cholesterol, decreased HDL, smoking are all things we know are independent risk factors for cardiovascular disease. So have a chronic disease, don't take care of it, and you're really, you know, the odds are against you. So, you know, moderate to high levels of physical activity, reduce total risk of cardiovascular death, independent of your age, your weight. So in this case, didn't matter if what your weight was, independent of that, you know, had favorable impacts. Next slide, please. This is the health professionals, 2,800 men developed diabetes later than 30 years, and they were followed for 12 years. And total activity was inversely related to cardiovascular disease. So I had a woman yesterday that, walks an hour a day, and, she's on metformin, 1,000 milligrams. That may be a medicine you're familiar with or that you take twice a day. Her A1C is, 6.4, which is excellent. And she's like, I got to come off this medicine. I need to come off this medicine. And I'm not telling her to tell her otherwise, if that's what she aspires to, but she's doing everything in her power to really ensure that, that she has a diabetes, but she's living a healthy life with it. Next slide. And this is just, we've established that low fitness, and this is a study that years ago that came back, can you be fit and fat or fit and heavy? And the reality is you can. I mean, it's ideally to be, fit in a healthy weight, but nonetheless, not everybody's going to achieve a perfect weight. But this looked at over 2,200 men with type 2 diabetes, mean age of 50, and the risk of all-cause death was inversely related to their fitness level. And there was no significant trends across, one's weight. And so this was proved in men, as I showed earlier, in women. So next slide. So you can see that right here, that on the left-hand side is a body mass index of 25, which is, the desirable level, but not everybody's going to achieve that. But you could see that, the the adjusted relative risk of death was much lower the fitter you were. And that held true for whether your BMI was 25 or to 30, which would be considered overweight, or if it was greater than. And you can see those didn't matter. Well, what about diabetes prevention? We want to prevent diabetes, right? We have, almost 30 million Americans with diabetes, and then we have another 80 or 90 million at risk. How does fitness and activity impact that? Well, you may be familiar with the DPP. This is a program that's a national program that was started. And basically the goals of these participants were simple, maybe a little dated now. We wouldn't necessarily recommend a low-fat diet, although we might, but decrease calorie intake, and to get greater than 150 minutes of physical activity a week and lose 7% of their weight. These people were at risk. They had pre-diabetes. And then they were either given a medication. So next slide. And you can see the placebo, they were given really no effect. That, people that were taking metformin or this medication, they experienced modest weight loss. And those people that enrolled in a lifestyle program around physical activity, support around nutrition, experienced more weight. Maybe not the 10 or 20 or 50 pounds people would like to lose, but they experienced significant weight loss over this 4-week period. Next slide. And, consistent with the program, their lifestyle activity, change in physical activity increased. And actually it stayed, although the program only lasted, less than a year. People were followed for 4 years out, and they really continued to adopt a regular physical activity program, certainly more than, the medication or placebo group. Next slide. And you may be familiar with these outcomes. What happened, the incidence or onset of diabetes. That certainly the people that took metformin had a 31% decreased risk compared to the people that were in the placebo group. But those that had participated in the lifestyle had a 58% improvement. And if you're older than 60, people that were older even had better outcomes. So this program, this study led to, programs, diabetes prevention programs that are in many YMCA hospital centers throughout the country. So we can prevent diabetes. Next slide, please. So just take 1 second, stand up. We're almost done. And just give me a nice stretch. So reach those arms. If you're in a chair, you can just reach up, giving yourself a stretch break throughout the day is good for many reasons. Okay, let's get back at it. Next slide. So, what are the activities? We could talk, each of these sections could be a presentation, but we want to keep it simple. We want to limit our inactive time. So, every day we want to engage in some type of physical activity, right? And it doesn't have to be planned exercise, but it could be yard work, housework, walking, biking. We do want to schedule time for more purposeful physical activity or aerobic exercise. Again, it can be walking or more vigorous jogging. Key is finding, and you may know the prescription is 30 minutes most days of the week. That kind of prescription has been found to have the kind of be a threshold of benefit, but some is better than none, more is better than some, and too much can be excessive. But 30 minutes most days of the week can be broken up into 10-minute bouts throughout the day. A purposeful activity, though. Above that, making time for strength training and flexibility. Just that stretching we just did has benefits, or more formal yoga practice. And at the top, really limiting our inactive time, right? There is time for rest and relaxation. And some people may say that that's activity, but, downtime, but we want to minimize that, So next slide. This slide just speaks that, which is better, aerobic or resistance training? Well, they have different benefits, right? They're complementary. And that holds true for people with diabetes or anything. So the importance of, particularly through our lifespan is engaging in some type of muscle strengthening activity. Now you can see aerobic exercise with the green arrows have certain benefits in our muscles. And then you can see resistance training where the black arrows are in aerobics, the green arrows are in resistance. So they really complement each other. So next slide. And so this is what this study proved, which is better for the management of A1C back then, glycemic control. Took 250 adults, 39 to 71. And they engaged in either aerobic training, resistance training, or both for a period of 22 weeks. And really, they looked at the primary outcome. Now, if you're into diabetes, you may know that A1C isn't really the gold standard now. It's probably time and range, because you can have an A1C of 6.5 or 7 and have blood sugars, in the 200, 250s, and you can have a lot of low blood sugars perhaps. But at this time, before CGMs and more advanced technology, A1C was used. And so, either aerobic training or resistance training alone, if followed appropriate program, improves blood sugar control. But when you combine the two, that's when you get the greatest impact. Next slide, please. Well, there are challenges, to being active, particularly with people with diabetes, but people without or any condition, right? Although that's not to say there's so many people that really, engage in regular physical activity and derive all the benefits. But in diabetes, there are unique health issues, health and safety. So you may experience some neuropathy or nephropathy or retinopathy, eye conditions, or you may have some orthopedic or vascular conditions that may limit your activity. I would contend that these are even reasons to be more engaged, but they do make being active more challenging in certain instances if you have joint pain or if you have numbness in your feet if you have cramping in your legs or whatever those health issues may be. Certainly, if you're on insulin or certain medications, hypoglycemia is not a pleasant experience, and it can be very dangerous. And people that may not even recognize it, and they may have hypoglycemic unawareness, and add exercise or activity into that, and that can be very worrisome. It could be low fitness level, or weight may be an issue. So often starting an exercise program can be challenging if you're deconditioned, so to speak, or weight's an issue. A lot of people lack confidence or in their ability to be active. Perhaps access. A lot of people are isolating themselves now, fearful of going to a gym. Their safety concerns. They haven't had success. Exercise is too regimented. They've had bad experience around it. It's too prescriptive. 30 minutes of this. Do weight training twice a week. It's not enjoyable. And some people may perceive themselves as, being active because they never stop during the day. They're on the computer, they're tending to the kids, they're doing laundry, they're cleaning the house, they're on their phone or whatever it may be. There's a lot of things. They may say that they don't have any time and they think they're active, but in reality, they're very busy, but they're not physically active, and their cultural beliefs. So next slide. So how do we overcome these personally? Or if we're a healthcare provider, certainly we need to find something that's enjoyable, that's purposeful. I had a lady today, she's not a big walker, but puts headphones and a conversation with her friends, catch up time or music, and she's out there for an hour. So, she's multitasking, she's finding that purposeful. She's enjoying her walk, but at the same time catching up with friends, so forth. Social support can be important. Find like-minded people that, have common interests. Sometimes that can be difficult virtually as opposed to in person, but I do classes that bring, people together virtually, and we have a common bond. We certainly need to address blood sugar control. Best to start low, gradual, and go slow. Start with 5 minutes or 10 minutes of exercise we did and build up. You may need to get a supervised program or that may understand you and your special circumstances, or a peer, to support you. It's important to establish realistic goals. I think this is where many people fall short. They have these overly ambitious goals, and they set themselves up for failure. If we need to build trust, you need to make the decision. Nobody's going to make it for you. Address the barriers. Keep records, keep logs. Find what works for you, particularly around blood sugar. Next slide, please. So briefly, I don't know if anybody has type 1 diabetes on this webinar, but there are unique considerations. So we'll just talk about that just in a couple of slides. Next slide. But these also apply to people with type 2 diabetes that are on insulin. What we want to try to achieve, people that take the issue with insulin. If I exercise, I do not have diabetes. My body stops producing insulin, and I maintain my blood sugar at a very narrow range. If I put a continuous glucose monitor on my body and monitor my blood sugar, it may fluctuate subtly, but nothing drastic. I won't certainly go below 70 or become hypoglycemic. And I won't have a severe hypoglycemic episode below 54. And, if I do really high intensity activity, my blood sugar is not going to shoot up. It may just subtly, but my body's going to adapt. So that would be called euglycemia, just decrease in insulin, increase in counter-regulatory hormones. The liver's on the left that puts out glucose to fuel my exercise into my circulation, into my muscles. And I maintain a steady blood sugar unless I, run a marathon or something like that. What tends to happen with people with insulin is they take insulin through injections. They have too much insulin circulating in their body. They engage in physical activity. And lo and behold, their blood sugar can go from 250 to 50 in a short period of time. They become hypoglycemic, and that can be concerning. In some instances, we have no insulin on board. This would be a person that maybe has type 1 and they're not taking their insulin. Their blood sugar is 300. They engage in an activity. They have no circulating insulin, and they have a extremely high, and exercise can actually exacerbate that, increase those blood sugars. So we want to maintain that insulin level at the right level to maintain our blood sugar. So next slide. So there are so many factors that influence blood sugar, for for people in general, but people with diabetes, but also more so with type 1, the type of activity, the intensity, how long is it, the frequency, is it in the morning, is it in the afternoon, the evening, how fit am I, what's the environment, heat, cold, humidity, what's your physiological, mental state, nutrition status, when did you last eat, what did you last eat, how hydrated are you, if you're a woman, hormonal status, how much of this fuel do you have in your muscle we call glycogen in your liver, when was the last time did you have hypoglycemia, and that impacts it, what's your starting blood sugar, all these factors. So what you need to do is factor in, what's your exercise goal, think about what type, duration, intensity of exercise are you planning to do, what are your blood sugar targets. I would say a reasonable blood sugar target, for somebody with type 1 diabetes or dependent upon would be, 100 to 180. If you could maintain that range, you've been successful. If it's too low, then you're not going to perform properly, and you'll have to stop because of low blood sugar. And if it's too high, you're not going to perform. So, how do you manage your insulin, adjust it accordingly during and after exercise? And how do you take in primarily carbohydrates and other nutrients to maintain that blood sugar? Next slide. So some of you may have pumps and continuous glucose monitors. These technologies certainly help to manage your blood sugar around activity, but they're not a be all to end all. So next slide. So things that we need to do is we really need to adjust our insulin. We call that basal reduction, or take in carbohydrates. So if you're exercising in a fasting mode, you may need to reduce your basal rate prior to the activity, or MDI is it's multiple daily injections. So you need to maybe adjust your insulin. Some people will just do, take in carbohydrate, generally 20 or 30 grams every 30 minutes. Again, depending upon the activity. Depending upon, these are all longer than 30 minutes. Non-fasting, if you are on a pump or you're taking insulin less than 3 hours prior to a planned activity, you really need to, reduce your insulin or take into some carbohydrates. So this is really a process of, trial and correction, learning what works for you. This talks about just carbohydrate consumption without the adjustment of insulin, consuming 15 to 30 grams every 30 minutes, depend upon the activity. So these are kind of starting points, but really working with your healthcare team to find a system that works best for you, a plan that works best for you. It's not going to always be perfect, but you really want to avoid significant low blood sugars that tend to happen when you combine exercise or activity and insulin. Next slide. If you're really looking for, I had the pleasure of working with both of these people. Michael Riddell is in Toronto, Canada. He is a person with type 1 diabetes himself, but a researcher and an expert in the area of exercise and diabetes. And this is a book he published a while ago, but he has other articles. You can just Google his name and you'll see all the research and resources that he does. And Sherry Kohlberg, I've had an opportunity to write a few position papers with her. She used to be a professor in Virginia. Now she's comfortably retired in California. But go on, Google her name, and you're going to find just so many wonderful articles and resources. She has type 1 diabetes herself as well, on how to be active with diabetes or prevent diabetes through using exercise and activity. So with that, in conclusion, managing diabetes is challenges. There's no doubt about it. Anybody tells you otherwise, they either, don't know enough about diabetes, or, they're focused on. Most people can't focus 24/7 on their management of diabetes. But exercise is a medicine, and there's probably no more powerful intervention than movement for total health and well-being. Find out what works for you. Never stop trying. It's worth the time and the effort. Managing blood sugar is a process of trial and error. I would say if you're most oral agents, other than what we call sulfonylureas like glipizide, glyburide, these medications that cause your body to produce more insulin can cause low blood sugar. But if you're on metformin, or you're on a lot of SGLT2s, the newer classifications are the injectables, the GLP-1s, they don't generally cause hypoglycemia. So talk to your healthcare provider and have them explain, are the medications you're on, can they cause low blood sugar? Because too many people have myths and misconceptions. And the future is bright. There's so many more technologies, newer therapies, but we need to do the basics right before, you're looking for that next best medication that's just been released, right? And with that, there's my email. And, we have a couple minutes for questions. I ran a little late, as I always do. Thank you.
Thank you, Michael. That was an excellent, lots of great information there, kind of jam-packed. We have a couple of questions, if you have a moment. One question. So one question for our audience, from our audience today was, are there resources for people in Rhode Island who can't afford a gym membership?
Yeah, that's a great question. I mean, I know when I was in the Southcoast, we had walking clubs. So what I would encourage you to do is you could send me your email. Tell me, I'm a URI graduate. That's where I did my graduate work. And I did work at the Merriam for a while. You got to navigate, know where to look. Are there community health programs? Is a senior center the right thing for you? What are your interests? And then finding. But I emailed Deb Newell. Has her pulse on all things diabetes, and I know Lifespan had a program. I know Landmark has a program, a medically based program. Maybe there are scholarships available, supervised exercise program, particularly if you have, issues around exercise. So there are resources out there. You just have to avail yourself of them and don't give up until you find what works for you. But email me, I can help you on that journey.
We have one comment that came in. Someone who really enjoyed, having been sitting at their desk all morning, really enjoyed the short movement activity at the beginning. I can second that. That was pretty excellent, and something I should probably do more often.
Set your watch or your alarm to it, or
And And this kind of, the last question I have right now is kind of related. Somebody asks, if we're not really moving, is standing at our desks better than sitting? This is a question a lot of people I think have, is the standing desk, is it really beneficial if you're still just kind of standing there?
I mean, beneficial in what respect? If you're standing and you enjoy standing, then do it. But it's not, from a blood sugar standpoint, from a blood vessel standpoint, it's not gonna, what favorably makes our blood vessels youthful, what helps with our blood sugar is contraction of our muscles. Our blood vessels dilate, they open up, our heart rate starts to pump to circulate blood, right? And our muscles bring in that glucose. Those are the things that are gonna help our blood vessels and our blood sugar. But if you enjoy standing, go for it. If you can stand and you have a treadmill, stand and walk on a treadmill, right? Those are popular. If you could stand and every hour go for a 5-minute walk, better yet, right? So standing is probably good for your back, stretch, any movement is good. And if you like it, do it.
Excellent. All right. Well, that's pretty much it for today. I want to thank everybody who joined us. I want to thank Michael C. for presenting all of that excellent information. And look, we're doing this every Friday as part of Road to Wellness 2020. Every Friday at noon with a different healthcare expert telling you how you can live better, feel healthier with diabetes. We will be back next Friday at noon. If you want to join Road to Wellness 2020, visit www.riwdd.org, and that will link you to a Facebook group, lots of other resources, and lots more information for World Diabetes Day. So thank you again, everybody.
Together on World Diabetes Day for a walk. How about that?
There you go. Excellent. Excellent.
Michael, thank you for your time.
Thank you, Michael, and thank you everyone who tuned in today. We'll see you next week. Enjoy the rest of your day.